In many barangays, the issue isn't a lack of access to healthcare, but rather a lack of access to information. In a world where knowledge is power, one community embarks on a journey to bridge this gap, turning whispers of hope into powerful voices of change.
Miss, may doktor po ba dito? Ang taas na kasi ng dagdag ng anak ko eh. Doon kasi sa health center namin wala eh.
Hello po ma'am. Yes po, may doktor po. Pero pang number 16 po kayo sa kita.
People waste time searching, going from one clinic to another, only to find them closed or unavailable.
This can be frustrating and exhausting, especially when they are already feeling unwell. Instead of getting immediate care, they spend hours just trying to find a clinic that can accommodate them, causing delays in treatment and added stress.
In many barangays, the health center is present, but the information people need is not easily available. Residents often do not know the exact location of clinics, especially smaller or private ones. There is no clear system that shows where these clinics are or how to reach.
There is a lack of clear information regarding doctors' availability, price ranges, and the service offered at the local health facilities. As a result, people often feel confused and uncertain about where to ask. Scheduling appointment is also challenging, as most barangay health centers do not have a centralized booking system. Many individuals have to visit in person just to reserve a slot, which can lead to long lines and overcrowding.
These issues indicate that the barangay lacks a connected system to provide comprehensive and up-to-date healthcare information. This gap makes it more difficult for residents to access the services they need, even when those services are available within their community.
But now, this stops. We need change, development, and innovation.
With the constant conflict in the information, we introduce you the HealthNet. It is a barangay-wide network that provides all the information needed for various health inquiries. It is designed to connect people to healthcare instantly.
With this network providing information, it is easy to navigate the location, time, and the availability of every clinic in the barangay. It also indicates the available schedule and services they offer.
HealthNet is a one-stop mobile application where every health center in the barangay is connected.
HealthNet is a digital system that can be used through mobile phones, tablets, or computers, all in one app. Fast, simple, and convenient.
First, easy access to health information. With the use of this app, users no longer need to search manually or ask around. Second, convenience. It provides a centralized platform, making healthcare services more organized and accessible.
Third, reduced waiting time. Since the app has scheduling features, patients now can book in advance, avoiding long queues. And lastly, it increases health awareness. Residents become more aware and informed about the available services and preventive care in their community.
First, dependence on the internet and technology. Not all residents may have access to smartphones or stable internet connections. Next is digital literacy. Elderlies may find it difficult to navigate.
Third, data privacy and security risks. It must be properly handled and secured. Lastly, data accuracy. Clinics must regularly update their information. Failing to do so might lead to the system being unreliable.
First, partnership with the barangay and health centers. All local clinics, including private and public, will be invited to register and become part of the network. Second, system development and testing. The application will be designed to be simple, user-friendly, and accessible. Before full launch, it will undergo testing to ensure that it works efficiently. Third, training and orientation. Health workers and barangay staff will be trained on how to use and manage the system, including updating schedules and patient information. Fourth, community awareness campaign. Residents will be introduced to HealthNet through seminars, posters, and social media to encourage usage. Fifth, pilot implementation. The system can first be tested in one barangay before expanding to other areas. And lastly, continuous monitoring and improvement. Feedbacks from users and clinics will be collected to improve the system over time. First, improve access to healthcare services. Residents can easily find and connect with the right clinic, leading to faster medical attention. Second, increase the efficiency in health service delivery. With organized scheduling and information, clinics can manage patients more effectively. Third, reduced overcrowding in health centers. Patients can choose less busy clinics or schedule visits in advance. Fourth, stronger community health awareness. People become more informed and proactive about their health, and overall, improve quality of life. With easier access to healthcare, communities become more healthier, more productive, and more resilient.
Imagine every barangay connected through one health network. HealthNet can be applied not only in one area but in every barangay across the country.
With proper support, training, and technology, HealthNet can become part of everyday healthcare. A system where information is clear, services are accessible, and people are cared for better.
Health is not just about treatment, it is about access. And with HealthNet, every barangay becomes more connected, more informed, and healthier.